There is a war. It's happening now. It will decide the fate of humanity. The time to choose sides has come. We are the resistance. We are the Info War.
Welcome to the InfoWars Nightly News. It is Tuesday, October 7th, 2014, and I'm Leanne McAdoo. Here's what's coming up tonight.
Tonight, as Ebola spreads in Spain, there's anger that protective measures for medical personnel were not sufficient. Meanwhile, in the U.S., the CDC gives the all-clear for an Ebola caregiver to return to work as a nurse only 7 days after unprotected contact. And if a cop would do this over refusing to show ID, what would he do in a pandemic? All that and more on tonight's InfoWars Nightly News.
Shot by the police.
Ebola is a very serious disease, and the ability of people who are infected to carry that across borders is something that we have to take extremely seriously. At the same time, it is important for Americans to know the facts, and that is that because of the measures that we've put in place, as well as our world-class health system, and the nature of the Ebola virus itself, which is difficult to transmit, the chances of an Ebola outbreak in the United States is extremely low.
So that was El Presidente. He wants everyone to know that this is a very, very serious situation, but there's an extraordinarily low chance that it's going to actually be a problem here in the U.S. So a lot of mixed messages going on coming out of the government. And of course, they're saying, you know, they want to stop this epidemic at the source, yet they are refusing to implement a travel ban so that the infection can't actually leave from the source and go to other areas. But don't worry, the president is going to increase passenger screening techniques here in the United States. Of course, TSA is going to work extra hard on those of us here. Now, the president and the White House has not elaborated on exactly what those new screenings will entail, but possibilities include taking the temperature of travelers from affected countries once they arrive in the U.S. and, of course, more closely track the travel histories for international travelers who are arriving in the United States. Of course, they're already screening at the airports when people are exiting these Ebola-stricken nations. They're using various techniques like thermometers, patient screenings, and questionnaires. But of course, as we know, that's how patient zero was able to arrive in the United States. He lied on one of these questionnaires when it asked if he had been in contact with anyone who had Ebola. So of course, he just lied his way in on that questionnaire, and at the time, he was not showing any symptoms of this disease. So this is clearly not a foolproof plan that we're working with here. Now, the agencies are saying that implementing a flight ban would be bad for the economy. Of course, it'll hinder aid. But what happens if hundreds of thousands of people become sick? Now, even though Obama and the CDC are saying, don't worry about it, don't worry about this.
Then I would ask, based on all that's transpired over the past week, should Texas families remain confident in the ability of our public health system to respond to infectious diseases of this nature?
Because the patient had no symptoms on that flight, had no fever, had no symptoms on those flights, it was actually 2 flights over, there is virtually no risk. You can push me as far as you want to say 0. I will not say 0. It's knowing what I know. There is 0 risk. I said it. There it is. I shouldn't say that. There's no risk. There's no risk. Ebola virus could be sitting there, and if I'm touching it with unbroken skin, it's not a risk.
People are worrying about it. 5 Dallas schools so far have installed fever scanners. Now, the company that makes these fever scanners donated these to these 5 schools. They'll be able to monitor any fevers there. It's often the first symptom of Ebola, and it'll allow nurses to take the temperatures of these students without actually touching them. It'll read their temperature from a few inches away. So far, so good on that front. We don't have any more reported cases of any of these children who had been in contact to varying degrees with patient zero. But then, of course, we have the governor of Connecticut. He has declared a state of emergency over Ebola just as a precaution. He doesn't want to worry anyone. There is no actual patients there in his state that actually have this infection, but he wants the authority to quarantine and isolate people who may have been exposed. He just wants, he says it's essential that we be prepared and we need to have the authorities in place to allow us to move quickly to protect public health. So while the governor is here, these other schools are here to actively monitor and track any potential new cases of this epidemic. The governor of Connecticut is saying he just wants to be able to quarantine people that have a reasonable suspicion of coming in contact with this virus. Well, now we have the nurse's assistant who actually came in contact with patient 0. She called 911. She rode in the ambulance with him. She was there helping him when he was violently vomiting. She rides in the ambulance with him. It's only been about 7 days since we first heard about patient 0 being diagnosed. Well, the CDC has given her the thumbs up to return to work, her and her husband. Now, I'm talking about the stepdaughter of Thomas Duncan. She works as a nurse's assistant, and she has been in quarantine in her house with her husband and their 4 children. But it's only been 7 days, and they're giving her the all clear to go back to her job as a nurse's assistant. They're, just go on ahead. And we know you haven't waited the 21-day incubation period, but, just get on out there and go ahead and keep on rolling out that Ebola false flag. Now, luckily, when she was interviewed, she said that she and her husband, they haven't decided if they are going to return to work just yet or if they will, in fact, wait the full 21 days for the incubation period. But this is completely contradictory to what the CDC had to say.
Because it's such a deadly disease, people are scared, and it's normal to be scared. In fact, for the healthcare workers who are caring for people with Ebola, we want them to be scared. We want them to have a healthy respect of the risk of any lapse in infection control procedure. We want them to channel that fear into being incredibly meticulous about infection control.
So the director of the CDC is very specific that he wants healthcare workers to be very afraid of Ebola so that they take meticulous efforts in ensuring that this infection is not spread. And yet the CDC is now giving 2 nurses assistants the thumbs up to get back to work after they have not even completed the full 21-day quarantine. So this is just very bizarre. And of course, now we can report that despite wearing a protective safety suit, the nurse that was in Madrid who caught Ebola, she became infected. And here she's in her protective gear. Anger is, of course, growing throughout Spain as it is being claimed that these protective suits given to health officials are not good enough. And it has also since emerged since then that before she even tested positive for Ebola, this nurse reported to her employers that she was having a fever and fatigue, and she explained that she had helped treat Ebola patients. So, here again, we're seeing human error with being able to stop Ebola from spreading. So here she warned that she had treated these Ebola patients. She had a fever, but it wasn't until she went to her local hospital on Monday that she was finally admitted and tested for the virus. It's not the same hospital where she works. So here again, we have all of this potentiality for human error to be the reason that this is going to become a pandemic, could spread global. It's human error at the airport, human error at the hospital, human error when kids that don't know that they are sneezing and coughing all over their classmates. Meanwhile, the World Health Organization has warned that it is unavoidable that more cases are going to be diagnosed in Europe because of the extensive amount of travel between Europe and affected areas. And that's what we were initially saying when we heard that they were flying patients into America to treat them for Ebola. Human error is the issue here. And now some Ebola experts are worrying that the virus may spread more easily than was assumed. U.S. officials are assuring that co-passengers who are on the same plane with an air traveler from West Africa, they're perfectly fine unless that person has a fever of at least 101.5 degrees or is showing other symptoms of having Ebola. And the CDC says 0 risk. Now, I am no genius, But I know that anyone can take ibuprofen or a number of other things to take their temperature down. And if you're a person who is in a country that doesn't have good healthcare facilities there, and you know people in your entire village are dying from this disease and they're going to shut it down, you know, people are probably going to take some pretty drastic measures to get out of that country and into a country that's going to offer them better healthcare. So, of course, this whole checking for a fever thing could be easily duped by someone with the means to do that. Well, now a virologist who oversaw Ebola research while heading the U.S. Army's Medical Research and Development Command warns that those assertions of a zero-risk chance are premature. He says, "I see the reasons to dampen down public fears, but scientifically, we're in the middle of the first experiment of multiple serial passages of Ebola virus in man. God knows what this virus is going to look like. I don't." And then additionally, some public health specialists are saying there is no proof that a person who's infected but who lacks symptoms could not spread the virus to others. And another viral researcher, Charles L. Bailey, who supervised the government's research when they were responding to an outbreak of Ebola among several dozen rhesus monkeys who were housed for research in Reston, Virginia. He says that these unqualified assurances that Ebola is not spread through the air are misleading. He said, "We know for a fact that the virus occurs in sputum, and no one has ever done a study that coughing or sneezing is not a viable means of transmitting this infection." And that's what we've been saying. Basically, these monkeys were in very tight quarters, and that is how they were infecting each other with Ebola, through coughing and sneezing. But they just want to say, don't worry, it's not airborne. Everything is fine. Everything is fine. And of course, they're sending troops to Africa, and the Pentagon is now saying it's not a huge risk to the troops. They're not going to come in contact with these Ebola patients. Everything is fine. Now, despite the fact that they have failed on multiple occasions to contain Ebola, which is of course now spreading on multiple continents, the Defense Department is saying that the military is using strict protocols to protect the troops, and they're going to implement careful reintegration once they return to the U.S., right? So now we know that they are there in Africa to set up military bases. I mean, to help combat the Ebola outbreak. But here's some pictures of them actually setting up these prisons or FEMA camps, field hospitals for these Ebola patients. Just take a look at these photos. Now, this is Monday afternoon. Soldiers are erecting a barbed wire fence around what's going to become one of these treatment facilities. And they say here in this article, it isn't immediately clear if the fence was to help protect the camp from looters or to prevent sick patients from escaping. I mean, what does that look like to you? That is like razor wire right there. But don't worry, the commander of AFRICOM says the troops aren't going to come in contact with any of these Ebola patients, and any soldier who contracts Ebola will be flown back into the U.S. for treatment. And hopefully we will have the VA fixed by then for when the troops get back. Now, about this mandatory quarantine, obviously it is no secret that we are currently living in a police state. But take a look at this next video. Now, if a police can react like this to a person who isn't wearing a seatbelt, that's why he was pulled over. Just imagine what a cop would do to you if he thought you were carrying Ebola. Now, this is a police officer in Illinois. He was filmed smashing through a car window, then tasering and yanking out this passenger because the guy initially at first refused to show him his ID. The man then starts to pull out his bag to show him his ID. And of course, cops, they hate that when you actually acquiesce to their request. And so the cops all pull their weapons out. The man is there with his children in the back seat and with his wife. And of course, this is when things really escalated.
Y'all got a white shirt?
Look at my shoulder, dumbass. I got the bars.
You're going to come out of the car one way or the other. You want your kids to see you come out through the window?
While his girlfriend again called 911 for a supervisor to come to the scene.
I am scared. And he got it, the man, they pulled a gun out. Why did my kids have to see that? Oh,
damn!
Right ground.
So that is absolutely unbelievable video footage. People are getting shot every single day in America by the police, and then this is what we see on film. So it's no wonder that this man was afraid to step out of his vehicle when all the cops are pointing guns at him. Now, Jones's attorney points out that at no time was there ever a search of the car, nothing to suggest that any criminal activity was going on. The police just immediately draw their weapons. Now, the Hammond Police Department issued a statement, of course, defending the officers' actions, saying police officers were at all times acting in the interest of officer safety. What about the little girl that was in the back seat of the car? Didn't worry about shattering glass all over her or scarring her for life as she's watching her dad being tasered and then dragged out of the car when the cops just busted through the window. And then they go on to say, in general, police officers are allowed to ask passengers inside of a stopped vehicle for ID, and they can also request that they exit a stopped vehicle for the officer's safety without a requirement of reasonable suspicion. So notice those two words, they can ask and they can request, but also people have the right to deny those requests. Now, officers basically can't just bust out your window and then drag you out of your vehicle because you are trying to get your ID that they requested, and then all of a sudden they become afraid, which I just do not understand at what point in America did being a police officer become a zero-risk job. That is why you always keep the cameras rolling. Of course, these people are going to be taking action against the Hammond Police Department, and several officers involved in that altercation already have some lawsuits for using excessive force in the past. So I think it's going to turn out lovely for the Jones. Now, coming up, people have been asking for the release of the 28 pages that have been taken out of the 9/11 Commission report. Well, we're going to take a closer look at U.S. ties with Saudi Arabia. And then, Motherboard wants to know why conspiracy theorists have such a big problem with transhumanism. Well, we'll show you why right after this.
DNA force. When cells become toxic, they die early and aging sets in. DNA force. No one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. Just one of the key compounds, BioPQQ, is backed by major clinical studies. DNA force. We now have the synergistic solution. Secure your DNA force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA force.